there a simpler way? Excuse me for the sound effects on my slide. Yes, there is. There is a simpler way to accomplish our goal to cover the costs and cover the uninsured and cut costs. There are better ways other than bankrupting our country, employing rationing boards, and destroying the doctor-patient relationship. And hopefully this is something all of us can agree on, regardless of whether we come from the left or the right or the center or up or down. Healthcare costs are too high, and the uninsured need options for care. Insurance companies need reform with regards to how much they cost and with regards to aspects of things like rescission. Now, hopefully these are things we can agree upon with everyone. That choice is good. Whether that choice is your physician or the type of insurance that you get. The doctor needs to be in the driver's seat. The patient needs to be shotgun. Insurance and government shouldn't be in the car at all. So let's talk about a couple of these alternatives to Obamacare. They exist and they're great. These are some members of some various physician agencies that are out there. There's Docs for Patient Care. I'm a member of that. Doc Squads, also of that. DPMA, yes. American Association of Physicians and Surgeons, and there's also an independent physicians group. All these groups actually just share a similar goal of trying to deliver health care better and cutting costs. I'm sorry, this slide's messed up twice now. There are two plans that are out there. They are in the House right now. One is Congressman Tom Price's bill. This is 17 pages long. He is a physician, an orthopedic surgeon in Georgia. This is readable. We'll discuss it just very briefly because it only requires 2 slides. Paul Brown, interestingly enough, also a physician, also a congressman, also from Georgia. He's a little bit verbose in that he's 51 pages long in his bill. Briefly, we'll discuss his bill first. Of course, it involves repealing Obamacare and also repealing the floor on medical expense deductions. So instead of having to reach a certain amount in order for it to be deductible, repeal that floor. Expand the use of HSAs, health savings accounts, and establish a charity care credit. What that means is if I, or a private physician, because I work for a large medical group, I can't say who, but you know, if a private physician takes care of someone who doesn't have insurance, that physician can write off the cost. Okay? Who does that cost? Okay, I guess it costs the taxpayers, but it's a lot simpler than creating a bureaucracy with 159 new boards and agencies and putting an insurance commissioner to tell physicians how to take care of their patients. It's simple. Create a Medicare premium assistance program, which means give Medicare patients a choice. You basically give them the credit for what Medicare costs. They can either take Medicare or they can use it toward another private insurance plan and make insurance so it's sold across state lines. I mean, this is a no-brainer. It's been bounced around by Republicans for years. It needs to happen. We're going to talk briefly about Tom Price's. So you can see these are very simple. It's going to increase access. It's going to decrease costs. Tom Price, he has a lot of similarities. He discusses establishing tax credits for health insurance costs of low-income individuals, where patients, families can get a tax credit up to $6,000 to go out and purchase health care insurance. There's an equal employer contribution rule where basically an employer can either offer health insurance or instead of offering health insurance, putting that pre-tax money to that patient and they can go out and buy their own. That way, first off, patients get more choice. Second off, if you leave your job, your insurance goes with you. You don't lose it. In Tom Price's law, you mandate state high-risk pools. There are already 35 states with high-risk pools. And create individual membership associations. Meaning, if you have your own business, you can pool together with the other friends that have your own business and form your own IMA and use your bargaining power to go out and purchase health care insurance. It allows small business fairness, where basically small businesses, if you're at a trade organization, you can bond together with other trade organizations outside of your state, and again, pool your resources and your numbers to go out and negotiate a health insurance contract. Again, allowing insurance to sell across state lines, improving beneficiary choices for Medicaid and CHIP, which is similar to what can happen with Medicare. Give patients the tax credit for Medicaid or CHIP, and they can either get Medicaid or CHIP, or they can go out and look for private insurance or apply towards private insurance. And Tom Price's bill has medical liability reform, which we'll touch upon in a moment. So, after one of my talks, a tax attorney came up to me and said, you know, the United States has 4% of the world's population, but 94% of the world's lawsuits. I said, that sounds too bad to be true. You've heard it's too good to be true. This sounds too bad to be true. So I looked it up, you know, the almighty Google, and he was wrong. He was wrong. The U.S. has 5%, not 4%, 5% of the world's population, and 94% of the world's lawsuits. Now you see there's this picture of me with some guy. That's not my husband. Okay? That is my brother, the OBGYN. And I put this picture in there on purpose. In April, he went to his office meeting, just like we have our office meeting. And amongst all the other things
No, you're fine. You're fine. It's not
they discuss is their medical liability insurance. Their liability carrier came up and said, I'm sorry, I think we may have to drop your practice. And the reason is not because they have lost a single lawsuit, because they have not. It's because they have more lawsuits brought against them than any other of practices that that carrier manages by one law firm. This is the third largest county in South Carolina, right outside of Charlotte. To defend each lawsuit costs that company $500,000. So my brother still is a little bit in limbo. First off, he, like me, is considering other options outside of medicine. Second off, they don't know if their practice is going to have to close. They don't know if their practice is going to have to leave that county, or whether he's looking for another job. His practice hasn't lost a suit, folks. 90% of physicians perform defensive medicine. 92.5% of orthopedists order imaging studies like MRI, CYA, and physicians attribute 34% of healthcare costs to defensive medicine. This is something that's kind of hard to really scientifically study, okay, how much defensive medicine goes on. But this is not addressed in PPACA at all. Liability reform has been estimated to cut healthcare costs by anywhere between 5 and 34%. And almost half of physicians have restricted practice for risky procedures or patients that we deem as being potentially litigious or emotional patients. And this was actually posted on the American Academy of Orthopedic Surgeons website. Now, defensive medicine has been estimated, again, by a study on the American Academy of Orthopedic Surgeons website, to cost somewhere around $150 to $200 billion a year, or to cost each family around $1,700 a year. Think of what you could do with that. This isn't discussed. This is so important. Almost half of Congress are lawyers, and obviously there's a conflict of interest there. Tort reform needs to involve things like medical specialty courts, where we determine the merit of a case. And I tell you, if a patient experiences negligence and it needs to go to court, it needs to go. I'm a patient too. These monetary judgments need to be calculated by an expert panel, and there should be a cap on non-economic damages and a loser pays system. So this means when a patient comes and says, Dr. Triepel, I'm going to sue you because my thumb didn't turn out right, and he loses, his lawyer pays. Medical specialty societies, not bureaucrats, are those that should decide best practice guidelines. Tom Price's bill, he does incorporate malpractice reform, limiting non-economic damages to $250 grand. Texas does that. Limiting lawyers' fees, making it tougher to reach punitive damages, and establishing these healthcare tribunals to discover the merit of the case to see whether it needs to go on to trial or settle. In Virginia, currently, just gee whiz, we currently have an aggregate cap, economic and non-economic damages of $2 million per year, and the Medical Society's big win a couple of years ago was capping this with just a little increase of $50,000 per year up to 2032. Texas has a cap of $250,000 on non-economic damages. Insurance reform. I didn't learn this until I started getting into all this stuff. Health insurance wasn't tied to employment until World War II, when there was limited manpower. And you had a cap on what you could pay, and so an additional way to attract employees was to offer them health insurance. It's not sold in a market, a true market like auto insurance across state lines. It is so heavily regulated by these mandates and things that you have to do, these expensive options you have to include, that this really increases the costs. True insurance is analogous to automobile insurance in that it really should cover catastrophic care. And if we encourage health savings accounts, this is going to help drive down costs. It puts us as patients in the driver's seat with our money. We're going to seek out the care that's most effective, yet we still have that insurance for when there's a catastrophic problem. Insurance, true health insurance reform needs to be portable so that when you move, it moves with you. Think about what that will do to pre-existing conditions. We need to eliminate the interstate restriction on the sale of health care insurance, give the same breaks to individuals that we do to employers, and create these high-risk pools for pre-existing illness. We need to allow small businesses to pool their risk, eliminate the dependence of insurance on employment, maybe allow but eliminate the dependence on it, and encourage HSAs. HSAs have been shown to incentivize consumers, us, patients, to control costs. It stimulates the market costs, control, and competition, and it reduces healthcare costs, as is demonstrated in this Mackinac study of public policy. Estimated $200 billion a year would be saved by using HSAs. And if we don't use the money in our HSA, we get to keep it, and it continues to grow. This empowers us, the individual. Now, we're going to discuss personal responsibility. We are so great at so many things in the United States, including being fat and smoking and dying of preventable injuries, gunshot wounds, motor vehicle accidents. The determinants of early death, 40% due to lifestyle and behavior, are poor choices. 30% due to genetic makeup. We can't change that. 20% due to social and environmental factors. Only 10% of early death in the United States is due to lack of access to medical care. So, myth versus reality. Barack Obama had promised that the average family premium would decrease by $2,500. But actually the CBO estimates it's going to increase by $2,100. We have been told that the cost is going to be $938 billion. There have been recent estimates that the cost is as high as $1.7 trillion, or double that. And in March of 2010, we were told that it's going to decrease the debt $138 billion. But a Medicare trustee says that it's actually going to increase our deficit $340 to $530 billion over the same interval. Our to-do list. Okay, get ourselves out there. Don't just talk to people that we agree with. Meet new people. Engage in polite conversation to try to find something that we share in common, and then maybe bring up different points. We need to get conservatives into office. Yeah. Once we do,
amen, brother,
we got to hold their feet to the fire.
Amen.
Not to be corrupted by the Washington machine. We need to repeal and replace the president's health care law before it does more damage to patients and the fiscal state of our country. Thank you all very much. Now open to any questions you have.